Good afternoon, everybody. Welcome to this lovely Monday afternoon. My name's Crystalline Montgomery. I'm with the Health Fairview Psychiatry Integrative Wellness group. And thank you all for joining us for today's wellness break. For those that are new to this is a weekly series that we're offering. We started offering this spring, and we're trying to have this run through as much of the summer as possible. Obviously free of charge for anyone who's interested. All of these sessions will be recorded. So if you miss this session for whatever reason, or if you know someone who would like to listen in, but their schedule doesn't work for this time slot, feel free to encourage them to click on the link that we send out at the end of every week. If you have not been receiving that link, I'm gonna show an email at the end of today's session where you can email that address and let them know that you'd like to receive updates. So without further ado, we're going to get started on today's talk. The way I like to do these is it's a little challenging with the Zoom, and we try to make the best of it. Under normal circumstances, this would be a fun time to actually get together in person and talk through these topics. But what we'll do for today is I always have the chat window up on my side of things. So I encourage people to please ask questions throughout today's chat at any point in time. If it's something that makes sense to answer right away, I will do so. If it's something that makes sense that we're gonna talk about later on, I'll probably hold on to that question and answer it later on. So today we're going to talk about the microbiome and probiotics. I often field a lot of questions about this in private practice and when I'm educating residents or even talking to other providers. So we're going to talk about this. We've just so you are aware, the upcoming weeks, the topics, next week we are going to talk about, it sounds really complicated, but it's not actually that complicated, emotions, neurotransmitters, and hormones, simple ways to support your mental health at home. That's really going to be about sort of the intersection of how hormones can really influence brain chemicals and brain chemistry balance and vice versa. The following week is going to be after the 4th of July holiday. We're not going to have a session that week, but then we'll come back July 13th, and we're going to talk about recovering from stress and how to really optimize sleep, since that can be tricky for a lot of people. So this is a question I often ask people because microbiome is a term we hear a lot of nowadays. It's in the news a lot. We hear about it. We hear about researchers doing more studies on the microbiome. And I always like to double check with people and just kind of get them thinking, like, what is actually the microbiome? I always explain to people that it is something that, I'll go back a little bit, it's something that actually encompasses much more than our gut, and we'll talk briefly about that. But the more that we learn about it, the more we realize we still have a lot more to learn beyond what we've already found out. So today we're going to cover some basics. Obviously, the microbiome is a topic that we could very easily spend a ton of time on. I mean, there are conferences and seminars that go on for weeks about this. And clearly there are people out there who do research in the field of the microbiome who do this for a whole lifetime. So what we're trying to do is give a snapshot with some take-home ideas, some things that are easier to implement using the knowledge that we have to date. So what is the microbiome? How do we take care of it? What are probiotics, and how do we know when to take them? Most people know what probiotics are nowadays. They have doctors or healthcare providers that are telling them to take it. And I get a lot of questions about it. So I just want to talk a little bit about how to understand when it's appropriate. Because some people feel like, oh, well, everybody should just take one, right? And yes and no. I mean, it really depends on the individual and what kind of health conditions they have going on, kind of health concerns they have. So to start off with, what is the microbiome? Well, the microbiome consists of all the microbes of your body, and technically it's genetic material. So we think about bacteria most commonly, but it also includes things like fungi, protozoa, parasites, and viruses. And it's true, the majority of the microbiome that we know of today sits in the large intestine or the colon. And if you think about it in terms of numbers, at last at last check, it's over 100 trillion microbes in the body. And this, is we talk mostly about the gut, but know that the microbiome also exists on the skin. We talk a lot about the oral microbiome. And while I sort of consider the oral microbiome to be part of the overall GI or gut microbiome, the oral microbiome can be pretty unique in its own and very specific to the oral cavity. So microbiome exists not just in the gut, but on the skin and other parts of the body. So what does the microbiome do for us? What do all those microbes do for us? Well, they do a host of things. And I will admit, this is again what we know of. I'm sure there are things that we're learning every day that they do that we didn't realize they were doing in the first place. It's very complex. It's also very fascinating. But at the end of the day, what we do know that they do is they help us digest our food. They help us make nutrients in our gut. So vitamin B12, they help us make B1 and B2 and vitamin K2. They help us regulate our immune system. They help protect us against harmful bacteria or harmful microbes like parasites and whatnot. They help us metabolize our hormones. So they actually help us balance hormones in a huge sense. And they also help metabolize some medications. So they're incredibly important for human health and well-being. And especially when it comes to mental health and immune health, but mental health especially, we're learning more and more that various types of bacteria in the gut can actually produce brain chemicals such as serotonin, dopamine, GABA, and these will all influence our behavior, decision making, so on and so forth. And so it's pretty cool when you think about it, because it helps you understand the complexity and sort of the function that what their function is in our body. So how do we care for our microbiome? This is really at the crux of today's talk, because I'm all about what can we do about this? We have all this knowledge. What do we do with it? And what I try to hone in on for people and really focus on is, we know that diet will impact the microbiome. It will directly affect what microbes or bugs live in the gut. We know that exercise will actually influence what types of bugs live in the gut. They do so, exercise helps increase butyrate, which is a form of food in the gut, but it also can directly impact other bugs that live there. And then we have things like prebiotics and probiotics, and we're going to spend more time talking on those in terms of both food-based and supplement-based, hopefully adding some clarity. So let's talk about what foods help us and our gut flora. What supports gut flora? I know probiotic foods get all of the attention, and you'll see them listed in this second row here on the left. The fermented foods like sauerkraut, kimchi, miso, kefir, yogurt, pickles, tempeh, natto. What I want to highlight is probiotic foods are a great source of healthy bacteria. And this list that is here on this slide right here is very abbreviated. Know that fermented foods, you'll find fermented foods for nearly every culture across the world. So in the United States, I find that these happen to be the more common ones that come up when I screen patients regularly. And they seem to be more common amongst people who live in the United States. But if you go to other parts of the world, know that each culture seems to have their own form of fermented foods. And what are fermented foods? We'll talk a little bit more about that as we go into it, but ultimately these are foods that undergo a process whereby there are bacteria that are produced from sort of the fermentation or the interaction with different substances within those foods. Sometimes it's a sugar, like yogurt and kefir. So like the bacteria will actually start to break down the lactose in yogurt, and then it produces lactic acid and it produces some other byproducts. Things like sauerkraut and kimchi, you have other parts of, say, like cabbage that are being broken down and digested by those bacteria. But what's good to know and remind people of is that there are lots of other foods that can support the healthy bacteria in your gut. And they do so by providing the bacteria with food. And for that reason, we call them prebiotics. And so you see here, we've got leeks, Jerusalem artichokes, onions, garlic, banana, oats, burdock root. A lot of these have different forms of either inulin, which is a substance that's found in these various foods, and these act as a more direct source of food for those other probiotics in the gut. When you go further down, you see even just whole unprocessed foods, like whole fruits and vegetables, beans, lentils, brown rice. These all have fiber, and so fiber acts as a prebiotic. And so I see someone's asking, does the type of brown rice matter, or is all brown rice in general good for gut flora? That's a really good question. Brown rice, it really depends on the processing. So, I think if you go to the store, I think more and more companies are putting a product on the shelf that has been minimally processed. When you look at some forms of like instant rice, whether it's brown or white, those are the forms that you just have to be mindful of, because oftentimes they've sort of had their nutrients and their fibers stripped from it. And then they've maybe added back in some nutrients to compensate for that, but it helps speed the cooking process up. If you go to the store and just buy a regular plain bag of brown rice, you're more likely to get all the benefits of that brown rice. So, there's long grain brown rice, there's short grain brown rice, and I have not yet seen any comparative studies between short and long grain to know that if there is a difference between the two in terms of their ability to sort of feed healthy bacteria. But I think what I always recommend to people in general is variety is a good idea. So maybe if you're used to eating short grain brown rice, or maybe 1 month you have short grain brown rice, and when you run out of that package, you try long grain the next month, or you try quinoa, or you try, different types of grains. Because as you'll see in a little bit, the more variety, the better for your overall gut health. And you can actually see that down in the fourth column or the fourth row there. It says trying new foods, rotating through different foods each week. Variety will in general support increased variety of bacteria or other microbes that live in your gut. Meaning that if you eat the same thing day after day after day, you might be feeding good flora, and that's the good news. So you can know, I'm eating a diet that's full of fiber and vegetables and fruits. I don't eat many processed foods. I don't really drink alcohol. And so that you're feeding certain bugs that are going to be healthy for you. If it's the same thing over and over and over again, you might be missing out on maybe some other bugs that prefer other forms of prebiotic foods. It's not necessarily a bad thing, but sometimes it's just something to consider. And it's just another reason to support the idea of everything in moderation. Variety is, always sort of encouraging yourself to aim for a variety. It doesn't mean you can't eat the same thing multiple days in a row. It's more like if you find yourself sort of getting into a routine without a lot of variety, it's just one thing to sort of encourage you to try to think outside the box every once in a while. So as you can see on the left side, again, this is a pretty abbreviated list, but know that anything with fiber in it is going to feed bacteria, many of those healthy bacteria. Variety is going to be great. And then you still have your probiotic foods. So there's some people, when they eat probiotic foods, they definitely notice a difference, meaning that they notice their bowels feel more regulated. But you will also notice that some people, if they attempt to eat fermented foods, they might feel a little GI disruption. And so sometimes when you're adding in bacteria, it's not uncommon for the gut to sort of say, whoa, that's something that's a little bit more potent than what I'm used to. And sometimes it can be very temporary and transient, meaning, oh, I had a little gurgly stomach, maybe my stools have changed a little bit, but then within a few days that resolves and things sort of go back to normal and you feel like a healthy regulation of bowel movements and whatnot. I always explain to people, if you introduce some type of probiotic or probiotic food and you're noticing changes in your gut, increased gas, increased bloating, loose stools, and that doesn't go away after a few days, that's when I say, you know what, either, talk to your healthcare provider about this, because it could be that your body needs something a little bit more specific and different than usual. And just as a reminder, on the right side, again, I'm always about balancing our relationship to food. So, when I look at the foods on the right that support unhealthy gut flora, I always try to explain to people, it's not like you can't ever have a glass of wine, for example, or, say you needed antibiotics for an infection. I mean, that is life, that happens. And the body has this amazing capacity to recover from that if we support it well. It's all about balance. So at the end of the day, or at the end of the week, or at the end of the month, kind of look at what is the balance between the foods on the left and the foods on the right. But in general, if someone's coming to me and they have chronic gastrointestinal complaints, one of the first things I'll do is just take a quick look at, what are you eating on a daily basis? And if the majority of what they're eating is more processed, kind of higher sugar, then I say, hey, why don't we start working in some of these foods from the left and see how your gut does with that? So one thing I do want to touch on real quickly, because I know we tend to focus the conversation a lot on food, and with good reason. But I don't want to underestimate or overlook the impact that exercise and stress management and just being outdoors can have on the microbiome. And they finally have started coming out with more and more studies that support this and sort of highlight the impact of these things. So when I'm talking to people, especially when we're trying to support mental health and support immune health, we know that these things will also, they support both mental and immune health by supporting the microbiome, and because they're having impacts on other parts of the body that can support mental and immune health. So exercising, and exercise, that can be kind of a word that everybody feels differently about. I try to remind people, this doesn't mean you have to get into a gym, but if the gym's your thing, great, go do it. This could be doing weight-bearing exercises at home, making sure you're doing 30 minutes a day. This could be just going out for a walk for 30 minutes a day. It could be whatever movement feels good to you, something that activates and engages your muscles, gets your heart rate up a little bit. These are things we're looking for. Stress management. This is super important, because one thing we have learned over time is that if cortisol levels go up, a natural response by the body is that it decreases something called secretory IgA, and it can also decrease output of stomach acid. And the reason why that's important is because those are things that can then impact our microbiome, the makeup of our microbiome. And think about it this way, if we are kind of living high stress life, things are super stressful in life, maybe we're not chewing our food all the way, maybe we're not totally breaking down our food. So, we maybe take a bite of food, we don't chew it all the way, we sort of swallow it, we don't have as much stomach acid output because we're a little stressed. And then that food travels into our small intestine. It's supposed to be broken down quite a bit, and it's not. So then what happens is it can inadvertently sort of start to feed bacteria that can increase inflammation. And then it sort of perpetuates this cycle. If there's inflammation in the gut, it can really impact our mental health and our immune function. So that's why I always encourage people, slow down, take a step back, take a deep breath before you take that first bite, chew that first bite of food all the way. It sounds overly simplistic, but the impacts that can have on the body, the benefits can be long ranging, which is, important to remember. So I also say to people, stress, we can't always get rid of it. It's there in life, it's there in the world. So it's important to find whatever practices help you sort of regulate your body's response to stress and recover from that stress. Whether that's meditation and mindfulness. I do acupuncture, so of course I'm biased, but acupuncture is not for everybody. Deep breathing can even do that. Just doing something you love and laughing can have huge impacts on your response to stress. And then lastly, what I think is pretty cool is nature time, or just gardening, getting in the dirt. So you don't have to be a master gardener to do this. It could be something as simple as just being outdoors and connecting to the earth. Because there's a whole host of microbes that live amongst the dirt and whatnot. And they've done an increasing number of studies that show if we don't get enough exposure to dirt or just nature at a younger age, they've seen an increased incidence of things like asthma or eczema or atopy or atopic dermatitis later on, both in childhood, but even later on in life. So, there are benefits to being outdoors, in addition to the fact that it can also support your mental health just by being surrounded by nature. So prebiotics and probiotics, one thing I want to move on to talk a little bit about supplementing with prebiotics and probiotics. We talked about the foods that can support the growth of healthy bacteria in the gut. We've also talked about the foods that act as prebiotics or provide the nutrients that encourage or sort of feed the healthy bacteria in the gut. So one thing I try to, because people always ask me, well, what should the probiotic have in it? And nowadays, when you go to the store, you're going to see, most probiotic supplements more or less have the same sort of bacteria in it. There might be some variations. They might not all be exactly the same. There might be one or two differences in the formula. When you look in the literature, for a lot of us doctors, we're kind of like, what's being studied? And a lot of different bacteria are being studied, but these are the most common ones. And for those that have maybe taken a probiotic before or maybe looked at them, some of these probably look pretty familiar, like the lactobacillus species or bacteria are the ones that tend to get the most sort of airtime. They get a lot of, people talk about them a lot as being important. Same thing with the bifidobacterium infantis. Now, what's interesting is Clostridium, we tend to think of Clostridium or C difficile, which we don't want. Most people are fearful of that. If you've ever had a bout of that after maybe a course of antibiotics, it's not pleasant. And some people can have a hard time recovering from that. But there are other forms of Clostridium in the gut that are not necessarily dangerous. They're what we call commensal, which means that they're sort of symbiotic and they support gut health. So this is an example, and again, I should say at the very outset, but I'll say it now. I have no financial connection to any company whatsoever, so I am more or less using these examples of different products purely as an example to sort of explain the differences for you and kind of highlight what you might see in the store. So I don't have any financial connections to any of these companies. I just use them to help, explain things to people. So if you were to look at, these are 3 different types of probiotics. So there's obviously many, many probiotics out there, but these are 3 very common over-the-counter brands that you'll find. And what this does is helps highlight the differences between all of them. So if you've ever looked at the labels, it can be a little confusing. You've got the Align probiotic, which does not have to be refrigerated. It's a very low potency, 1 to 5 billion CFUs. CFUs stands for colony forming units. And so we often will talk about dosage in terms of CFUs. And then you'll see this consists of just the Bifidobacterium infantis, okay? Moving on, you've got the Culturelle probiotic. Again, does not have to be refrigerated, a little bit higher potency, so 5 to 20 billion. And it's primarily the Lactobacillus rhamnosus. And then you move on, you've got the VSL3. Now, clearly this comes from the VSL website because they've sort of highlighted their product and making it seem even better and more special, but I'll explain in a second why that may or may not be the case for every person. So, this is something where, they want it to be refrigerated, it has more strains, or, you know, as you look here, you've got more bacteria, more different variety of bacteria in there, and the potency is much higher. So some people might say, well, geez, is higher better? And I say, well, that depends. You know, there are some people who have had very chronic gastrointestinal issues where, or they were just recovering from antibiotic therapy, where a higher potency probiotic might be a good idea. I have other people where we're looking for a more strain specific. You know, if I'm looking for something that has, you know, I want to be really specific about the strain that I'm giving them because I want to note if there's an effect or not, I might start with a single strain and just give them a Lactobacillus rhamnosus probiotic. And that way, then I can watch for any changes in their gut health or oftentimes for behavioral health. And then we can step back and say, did that seem helpful? Yes. Okay. Should we consider more of a formula? And we make that decision at that point. You'll notice when you go into the store, you will continue to see lots of different types of brands and formulas. And, you know, if you would have asked me maybe 5, 6, 7 years ago when there weren't as many brands, I would have been a little bit more picky about, you know, what brands people purchased. I'd say, well, I really think these are the companies that sort of are ahead of the game in terms of research and whatnot. Now that there's been more research done on probiotics and people are sort of using different patented organisms or bacteria, you're going to see a lot more, you know, everybody's more or less comparable. So what I'm showing you here is, you know, this one probiotic it's a multi-strain formula. So it's a pretty broad spectrum formula, kind of similar to that BSL that we just looked at. It's got some lactobacillus, it's got some bifidobacterium, it has a little bit of streptococcus. So these are all bacteria that are considered beneficial to the gastrointestinal tract. And I always explain to people, look at, you know, do they label each bacterium? You know, how much of each bacterium is in there? Sometimes they label it individually, sometimes not. This isn't something where the FDA has established or the USDA hasn't established like how much each individual should have, because it's such an individualized recommendation. And then I explain to people, also look at the other ingredients down here at the bottom. You know, are there a lot of extra ingredients in that product? Yes or no? Ideally not. You just don't want to be adding more things into your product that your body may react to. And then look up at the top, and this is something that for some people can be important. If you notice in this probiotic, it says probiotic blend 25 billion CFUs in a base of inulin derived from chicory root. So remember when we talked about chicory root as being sort of that possible prebiotic, that's exactly what that is. So this product is, in essence, is saying we've got probiotics in here, and then we've also sort of put those probiotics into a base of prebiotic. So you're getting a little bit of both. Some will label the prebiotic specifically, and I'll show you that in just a second. Over here on the left, you see something called Flora. So this is a common over-the-counter product. And what makes this one unique is that it consists of Saccharomyces boulardii. Now, Saccharomyces boulardii is actually a yeast. It's a beneficial yeast. So oftentimes we think to ourselves, oh, yeast is bad. And in general, that's because we're thinking about it in terms of, oh, I just took some antibiotics and now someone has a yeast infection, or maybe they're feeling a little bit of gastrointestinal distress after antibiotics. So oftentimes that's because there's been an overgrowth of certain types of yeast in the gut. Usually that yeast is more of a candida species. So the Saccharomyces boulardii is a beneficial yeast and will, if anything, often crowd out the candida and help support the body. So, and the other benefit of the Flora is it's something that can be taken when you're taking probiotics because it's not going to be killed off by the probiotics. This is a question that commonly comes to me is, you know, if I'm taking probiotics, or if I'm taking an antibiotic, should I be taking a probiotic at the same time? And I say, well, it depends. You know, if you're taking a short course of antibiotics, so maybe 7 to 10 days, which is a pretty typical course, I often say to people, you know what, let's take the Saccharomyces boulardii while you're taking the antibiotics. And then once you finish the antibiotics, you can start a course of probiotics to support the return to normal of your healthy gut flora. Now, this is a pretty generalized recommendation. Obviously, if someone is receiving antibiotic therapy from their provider, they should confirm this with them, just to make sure it's appropriate for you. There aren't a lot of circumstances where I would consider probiotic supplementation a bad idea, but they exist, so if you're undergoing any type of therapy that impacts your immune function or your white blood cell count, such as any type of chemotherapy, some types of radiation therapy, some types of immunomodulating medications that can be given for autoimmune conditions. Those are all things where just because you're doing them doesn't mean you can't do probiotics. It just means that you really should talk to someone before you start supplementing with them to make sure they're monitoring and helping guide you in understanding whether or not they're appropriate for you. So what I'm explaining here is kind of in general, this is commonly what you'll see both in the literature and you'll see in practice. But of course, everybody should double check with their own individual doc. But so you can kind of see the difference here. You've got a probiotic over here, and we call the Flora store probiotic just because that's sort of where it sits in the grocery store. It's kind of near all the other probiotics, but technically it's a yeast, it's not a bacteria. So that's that. So I know I'm kind of flying through some of this information. So if anyone feels like, whoa, I have a question about this, again, I'll encourage you to put that question into the chat, and I'll be happy to answer it. So how do you know when to use a probiotic? And this is what I started highlighting when we were talking about the last couple slides. Obviously talk to your healthcare provider. The most common time when people will use a probiotic is if they've just taken some antibiotics, because we know that antibiotics, because they're good at killing bacteria, they're good at killing not just the bad bacteria, but also the healthy or good bacteria. And so we've come to the point where this is more widely accepted, and we have lots of data to support this. And for this reason, in general, people will recommend, okay, probiotic after you use an antibiotic to help support the return of healthy flora. A lot of people say, well, won't it just rebound on its own naturally? Yes, if you eat a diet that's high in fiber and probiotic foods, it will. It might take a little bit longer. Some studies, say it could take as long as a year to sort of regain your flora, your normal flora. I think it wholly depends. I mean, it's very hard to predict because it really depends on the individual, their genomics, as well as what they're eating, and a host of other factors. But certainly you could just really focus on probiotic foods and prebiotic foods to help regain that. Some people notice pretty significant symptoms when they take antibiotics. So the probiotic becomes a little bit more necessary for them. And as I said before, during antibiotics, again, this is more the Saccharomyces boulardii, because that's the beneficial yeast. That's, so sometimes if people are taking antibiotics, they'll take an antibiotic, they can take the Saccharomyces at any point during that course because they don't have to worry about it being killed off. If someone is taking more of a long-term course of antibiotics for various reasons, but something that they're doing daily for months maybe, then we talk about strategies in terms of dosing probiotics. Maybe we dose the antibiotics in the morning and you take your probiotic at night before bed. Certain types of digestive disorders, certainly you need to consider or talk to your provider about whether or not probiotics are right for you. In many cases, it can be appropriate, but I will caution, there are some circumstances where, growing number of people, if they take a probiotic, especially with some types of irritable bowel syndrome, will experience an aggravation. So, but sometimes that's helpful information to know. Sometimes I get people come in with something that looks like irritable bowel syndrome. And, my first question is, have you ever taken a probiotic? Oh yeah. Oh, that was awful. Oh my gosh, I got so bloated. It just doesn't matter. Oh, and so oftentimes it can help us sort of clue us in to, wow, this person might have small intestinal bacterial overgrowth. So kind of where there's a bacterial overgrowth in the small intestine that is actually contributing to their symptoms, and probiotics sort of feed or exacerbate that overgrowth and make them feel worse. So once we can sort of identify that and figure it out, it doesn't mean they can't ever take probiotics, but there are just some other things that need to be worked on first before they can take them. And then finally, C-section birth. So not uncommonly, if there are babies that are born C-section, we know now based on the data and the research that, they sort of, there's certain types of flora that babies obtain or get as they pass through the vaginal canal during birth. And if they're born via C-section, they don't necessarily get that. So more and more, there are different formulas that you'll see over the counter that are sort of like for designed specifically for babies if they were born by C-section, because they'll contain certain types of flora that are more common, that are commonly missed out on by babies that are born via C-section. A lot of people say, well, how do you feed a probiotic to a baby? Well, again, something you talk to your doctor about, but, it doesn't take a lot. Sometimes you just encourage the parent to feed like a little fingertip of powder, to a baby and let them suck on it. Or, it depends on the circumstances. Or if they're being formula fed, it can be put in the formula. If they're nursing, then sometimes you have to work with the parent who's nursing to make sure it gets in there a little bit. So different circumstances. Now, I know a lot of people will take probiotics for immune health or just for general well-being. There's not necessarily anything wrong with that. I always am a fan of, if someone comes into me and they've been taking maybe a lot of different supplements, but a probiotic, especially for, I don't know, a long time, like maybe a year, on their own, they just sort of picked it up and were taking it because they thought it was a good idea. I always look at the whole picture. How are your bowel movements? Are they regular? Do you have them daily? Are they easy to pass? Are they well formed? Do you have gas or bloating? Sometimes, people mistake probiotic as, there's a couple different ways we can support digestive health. The probiotic I see is helping sort of the lower bowel or the large intestine. There's other forms of digestive support that are going to support the upper part of the intestines, like the stomach and the small intestine, which will help alleviate gas and bloating a little bit more. Gas and bloating are usually a sign that your body's not breaking down food all the way. And so usually that's a sign of, first, make sure you chew your food. Second, make sure you have enough digestive fire there. So pancreatic enzymes or digestive enzymes, stomach acid, so on and so forth. And then we sort of look further down the bowel to understand the microbiome. So I kind of flew through a lot of different information. And like I said, microbiome's a tough topic to try to be really concise on, but I wanted to give just some basics. And what I want to do now is, we have about 8 minutes, 7-8 minutes. And I want to open it up if there are any remaining questions about things maybe we covered, but we didn't go into much detail, or it could be anything, honestly. I want this to be helpful for you all as well. Gives you a chance to ask some questions. What I'm just going to say here is, if you're not already a part of our mailing list and you want to be, and you want to stay up to date on, if we ever do future classes, like I'm doing these sessions on Mondays. One of my colleagues is doing mind-body sessions on Thursdays, Tai Chi and yoga. We also have just a mindful moment on Tuesdays and Thursday mornings, just for 15 minutes. It's a really nice break for your mind and your body. In the future, as the clinic sort of comes back into the full swing of things again, you would be informed of different services that'll be available to people. So acupuncture is certainly one of those. Individual mind-body sessions, naturopathic or functional medicine. So the acupuncture and naturopathic functional medicine are what I do. That's my specialty. And so acupuncture is covered by insurance. Naturopathic functional medicine is not at this point. We're trying to work out the details with that. But either way, if you sign up, you just get to stay informed on this. And I think that should be about it. But open it up to you guys. So I'll give you guys a couple minutes. If you have any questions, I'll let you type them on in. Don't be shy. There's no bad question. So I see one good question. Oops. And this is not letting me move my thing over here. So, how do I look at vegetarians or vegans in terms of diet and prebiotic and probiotic? Um, yeah, I think vegetarians and vegans, looking at, microbial makeup, what does their microbiome look like? What kind of, would I do something different for them for a prebiotic, probiotic? It really depends. I haven't necessarily yet found amongst my clinical practice that what vegans and vegetarians need in terms of a probiotic differs from what, say, I have some people who are maybe on a really specific paleo diet or a ketogenic or something like that. I mean, you will definitely see differences in the microbiome that are unique to, say, people who eat meat and people who don't. In general, I have found if the people that I'm working with are vegetarian or vegan or plant, like strictly plant-based, and they are not eating a lot of processed foods, I find that their flora tends to be pretty, there's a lot of variety. And then what I'm looking for, so in general, I find their microbiome is doing really well. But I have also seen that with people who eat like a paleo or ketogenic diet too. It just depends on how they do it, right? The other factors that I look for when I do microbiome testing is I look for sort of pathogenic bugs. So oftentimes I'm screening for that as well. So I don't, if I know that someone is eating a plant-based diet, my recommendation is still going to depend on other factors, more so like hormonally. How is their body metabolizing hormones? How is their GI motility? Meaning, are they having regular bowel movements? If they're not, then we take that into consideration. Also too, if there are any other signs, like what is their skin like and so on and so forth. So I find I still am doing a lot of lactobacillus species and bifidobacterium species. But again, it's more dependent on what their symptom picture looks like, because you have to remember the food is going to be part of what encourages the growth of different bacteria, but then there's a host of other factors that can influence that. Stress can be one, genomics can be another. And so I might have a plant-based person and a paleo person on the same probiotic, just because even though they're eating different diets, their needs might be somewhat similar based on other factors. So I realize that might not totally answer your question. What I do find is people who eat a vegetarian or vegan diet do tend to, and I don't have numbers behind this, so this is very, based on kind of what I can recall from clinical practice, they tend to eat a lot more foods that are high in inulin or prebiotic foods. So know that that happens too. Like sometimes those people do not necessarily need a prebiotic in their probiotic blend. So it just depends though. I mean, honestly, it depends more on what your symptoms look like as well. If my gut is feeling good, any reason to take a supplement? No, I don't necessarily think there is. I know some people might argue or disagree with that, but I think it really depends on the individual. And I've had plenty of people where they will take a supplement, they feel great when they're on it, and I will say, well, let's take a break from it and see how it feels. And then they take a break and we don't notice much of a difference. Likewise, sometimes I have people coming in and they say, well, my gut feels fine, but they're coming into me with other concerns. And those other concerns might range from they've got chronic eczema, their hormones are really giving them a hard time. They've got lots of hot flashes maybe, or they have really bad premenstrual syndrome, really crampy, lots of inflammation in other places, or they're coming in for mental, emotional, or behavioral health concerns, like they're chronically anxious or chronically depressed. And so that's what I have to explain to people, that your gut might not be having the symptoms, but you have to understand whatever is going on in your gut can create symptoms elsewhere. So for that reason, I still might recommend a probiotic to them. So if your gut is feeling good, I think I always encourage people, continue to do what you're doing with your diet and just focus on whole foods and whatnot. But remember that sometimes, what's going on in the gut doesn't always, some people, their gut shows the symptoms, and that's part of their picture. Some people come in and there's a lot going on in their gut, but their gut just isn't that that vulnerable spot for them, those symptoms are showing up elsewhere. So knowing, kind of going back to those first slides I talked about, where we know there's a lot of bugs in the gut that produce brain chemicals that lower inflammation, knowing that the gut has an impact on that, we may still have them take a probiotic, even though they might say, well, I don't have any gas or bloating, I don't have any heartburn, my poops are perfect, I have a poop every day, it's super easy, it's beautiful, that's not the only thing I look at. So hope that answers that question. All right. You all have been fantastic today. I wanna wrap it up so I can let you all get back to the rest of your day. I hope to see you all join us next week. And remember, if you missed any part of today, you can go back online and catch the link later this week. I hope you all have a wonderful day. Thank you.